Good evening and welcome to State Senator Tim Knopp's Tele-Town Hall. My name is Garrett Mosier and I will be your host for tonight's event. While we give people a minute to join the call, I'd like to thank you for joining us tonight to receive an update from our state senator. State Senator Knopp has been serving on the Coronavirus Response Committee and is supportive of calling a special legislative session for the state to craft their plan to respond to the ongoing situation revolving around COVID-19. He is looking forward to updating you on his work on the committee and what his goals are for a potential special session. We still have some people joining us, so hang tight and we will begin momentarily. For those of you who have just joined us, greetings. This is Garrett Mosier, and I will be your host tonight for State Senator Tim Knopp's Tele-Town Hall. We are going to begin the town hall right now, and I would like to thank you all for joining us tonight during this uncertain time in our state, nation, and world. I want to welcome Senator Tim Knopp to the call. Greetings, Senator. We look forward to your town hall meeting with the voters in your district here in Central Oregon.
Thank you, Garrett. I look forward to tonight's discussion and conversation, and there is a lot to talk about.
Yes, sir. With that, let's go ahead and get this town hall underway. First, I would like to take care of a few housekeeping issues. Tonight, there are a couple thousand people on the phone. We will begin with a brief update from the senator, and then we will open it up to questions from the audience. If you would like to ask a question, just press 0, and a staff member will add you to our queue. We will do our best to get to everyone's question, but if we run out of time, please email timknopp@gmail.com. and we will get your question answered there. If you would like to email us a question, we will do our best to get a response out as soon as possible. Tonight's town hall is intended to last 1 hour, but sometimes these end a little early, so we will see what happens. Hopefully the instructions are clear. If you have a question, just simply push 0 and you will go to one of our staff members. Great. With that, allow me to introduce Senator Tim Knopp. Senator?
Thank you, Garrett. Thank you all for joining the telephone town hall. We are all aware of the unprecedented nature of this invisible virus that we face. Just to give you some statistics about what's happening, there are 690 confirmed cases of the coronavirus in Oregon, with 18 people who have died. And there are 25 cases in Deschutes County, so the virus is among us. A big thank you is due, I think, to those serving on the front lines, including all the doctors and nurses and respiratory therapists and all the medical staff at our hospitals and clinics. And a big thank you to the cleaning staff, whose job is critical to everyone's health and safety. I also want to thank grocery store workers and truck drivers who are keeping us fed and the stores stocked. I continue to be impressed by our community and how everyone is working to help one another. And one of the amazing groups that is out there and that is helping out is a group that has been started just a couple weeks ago. It's called Pandemic Partners, and they've been doing a great job at connecting people. They're on Facebook. If you go online to Facebook, you can join that group, and they've been doing an amazing job helping people out and procuring personal protection equipment for healthcare workers and other things that people need. Many people in the community have been doing that as well. We've had dentist's office and pharmacists and other clinics, as well as Oregon State University, Cascades campus, have all been collecting what they call PPE, which is personal protection equipment, So those are the masks and the various things that healthcare workers need and that are in short supply because there's a global shortage, obviously because this is a worldwide pandemic. And a lot of the personal protection equipment is made in Asia, and they were the people who saw this first and therefore were impacted and used a lot of that personal protection equipment for themselves. So we're in the process of procuring that. So that's really our number one goal, is to make sure that our healthcare workers, our frontline workers, have the personal protection equipment that's needed. So everybody who's out there and is working hard to make sure that happens, there are people in our community who are sewing masks, and I just say thank you and please continue the great work that you're doing. Other things that I'm working on, I'm working to secure funding for food banks in Central Oregon and across the state. It's really important that we make sure that everybody continues to have a meals every day and they're well fed. Another issue that I'm working on is immediate cash relief for people who have been laid off and for small businesses and sole proprietors who need cash flow to continue to operate. We're also working on housing, trying to make sure that housing is available and that people stay in their housing. So allowing people to be evicted during this crisis, both on the residential side and on the commercial side. Also working on delaying implementation of the commercial activities taxes, that gross sales tax that on businesses that was passed in 2019. It's coming, and its implementation is starting at an incredibly bad time and is going to create even more cash flows for business. So we're trying to suspend implementation of that for the first couple quarters of this year so businesses can catch up to be able to pay that. We also want to make sure that unemployment benefits are getting to the people who need them, including sole proprietors who normally don't qualify for the program, but we're trying to make sure that happens. And then, unfortunately, at times like these, domestic violence increases. And so trying to get more funding for the people in our community who work so hard to try to help people get out of domestic violence situations. And so those are just some of the things that I'm working on as we come up on the special session. And those are the recommendations that I put in at the committee that I'm a part of in Salem working on this issue.
Okay, great. Thank you for an informative update. Now it's time to take your questions, and we have lots of questions to get to here. Remember, if you have a question for the Senator, press 0 and you will go to one of our staff members. Our first question is from Diana. Diana, are you there?
Yeah, this is actually Henry, but my question was about, they say they can't transfer on animals like pets, but I mean, if you can get it on your shoes and things like that, and I don't think people really realize that, and I see people in the dog parks walk around and other people pet their dog and they think they're keeping their distance, and I don't think that's safe. And the other one is the homeless situation. Is there anything they're doing about the homeless people that are out in the deserts and stuff here? We seem to be kind of camped in groups.
Yeah, Henry, thanks for that question. There's some really incredible people that work for Mosaic Medical, and they have a mobile vehicle van that they take out there, and they work with a lot of the homeless in terms of trying to help them with their health care. And those who are homeless are very susceptible to getting this, because if they're camped in areas together, that's obviously a problem. And we all learned some new words called social distancing in the last few weeks, and it's really important that everybody does what they're doing right now, which is really, stay home and stay healthy. Every interaction you have puts yourself and someone else at risk for the virus, because obviously we can't see it. We don't know what surface it's on. We don't know how long the virus might be in that area. And so whether it's the homeless or whether it's the vulnerable populations, we need to all be doing our part. Be careful, be safe.
Thank you, Henry, for your great question. Next, we're going to take it to Michael. Michael, can you hear us? Michael, do we have
Hello?
you there?
Yeah.
Hi, Michael.
My question
you are
is,
live with the senator.
Okay. Hi, Senator. I was on the committee about 15 years ago, and we knew each other a little bit then. I am a 100% VA disability, and I've got Pacific Source, St. Charles, and if I get sick, I'd like your opinion on what's the best avenue to follow, to go to the VA or to go to Pacific Source.
Well, Michael, this goes for everybody. So whoever your healthcare provider is right now, you're going to want to contact them if you get sick and you feel like that you have the symptoms. So the symptoms have generally been high fever, cough, pressure on your chest, being hard to breathe. Those are the main symptoms of this. And so if you're sensing those over several hours or a day or two period, you're definitely going to want to contact your healthcare provider and take that direction from them as to where you want to go, where you're going to meet up. And then, we are encouraging people not to go directly to the emergency room, but if you have a healthcare provider, contact them first. And if you don't, then by all means, certainly avail yourself of the emergency room. But what we're trying to do is to make sure that emergency rooms don't get overwhelmed, as well as hospital beds don't get filled up and overwhelmed. And people who have this in a severe way ultimately are going to need a respirator, and there are not a lot of those that exist in most areas of our state. And so it's really important that everybody is following the direction of their healthcare provider. And St. Charles has been very clear. They really need us to, stay at home as much as possible. Obviously, getting out in the yard, if you can do that, or going for a walk, keeping distance from other people, very important to everybody's health. But if you do feel like you're sick, try to stay away from others so as not to create any more spread than is necessary, because what we've been told is 10 to 14 days prior to you feeling symptoms, you are infected and can potentially pass this on to others. And so that's why the governor made the call that she did and asked people to, to stay home and stay healthy.
Michael, thank you for your call. Just a reminder to everyone else on the line, if you have a question for the senator, just press 0 and we will get you into the queue. Our next question is from Torin. Torin, do we have you there?
I was wondering when I'm going to be able to go back to school.
Well, that's a great question, Torin, and I wish I could tell you soon. Unfortunately, it looks like, even though the governor said April 28th was the likely date for people, for kids to be able to get back to school, it appears as though that it's not going to be possible this school year. So what is happening are a couple of things. One is for students who get meals from school, both in Redmond and in Bend, they're making grab-to-go meals on a daily basis for both the Redmond School District and the Bend School District, with multiple locations. I believe Redmond High School is one of the locations in Redmond, and in Bend there's 4 or 5 different locations. And we'll put those up on our Facebook page to make sure everybody's got those. But as far as schoolwork goes, it's going to move to distance learning online. So both the school districts are going to be contacting students. You'll probably get a call or an email from your teacher letting you know when your distance learning is going to start. It's going to be quite a bit different than what students are used to. And, this particular class of students is going through something that most students have never experienced before. But your learning is going to be remote and online, and we're going to probably finish the school year like that in all likelihood. They expect the coronavirus to peak in early May is what it looks like. They had been thinking it would be mid-April, but now it looks like it's going to be closer to the end of April or early May. And we obviously don't want to send kids back into school with the virus at its peak. So while I wish I could tell you you're going to go back to school soon, actually going back to the physical building with your classmates is probably going to be, unfortunately, this fall, come August or September, depending on when they want to start the school year this time. Thanks for the question, Torin.
Yeah, great question, Torin. Next, we have Scott from Redmond. Scott, can you hear us?
Great, thank you, and thank you, Senator, for putting on this town hall. Obviously, these are difficult times. I have a saw shop over here in Redmond and had to lay off my staff, and there's a lot of confusing information about all the different support for small businesses. And I think, we're checking into it and going online, but there's federal support, and is there any corresponding state support that you can speak to?
Well, thank you. There is going to be some state support for small business. That's what I'm working for. That's what I've been talking to my colleagues about, is there are going to be significant resources coming in from the federal government and multiple programs that will be available for small businesses, including paycheck protection, which will be to cover the payroll if you are going to keep your employees working. If you're not going to keep your employees working, unemployment is going to be the best option. The federal government is going to increase the amount of weekly take-home pay that somebody would get on unemployment. And then there are basically emergency funds for businesses for cash flow purposes. And so our goal for the state is to fill in the gaps that don't cover certain people. Like we're very concerned about sole proprietors and kind of businesses that just have a single individual, the business owner. And there are a lot of small businesses that really are the backbone of our Central Oregon economy, and they're working really hard. Normally they wouldn't qualify for certain programs. They are going to qualify this time for some. And then the other group that we're very concerned about is landlords. Both at the state and federal level, there is an order in place that you can't be evicted for non-payment of most mortgages and rent. Doesn't mean you don't have to pay them at some point, because you'll have to pay them. But if you're late, we want to make sure that you're not paying late fees. But that also puts the landlord in jeopardy. We want to make sure that landlords are able to have the cash flow and aren't just left holding the bag. And so for landlords, we're going to try to make sure that there's some support there for them as well, so they can pay their bills and continue to provide the much needed housing, especially in Central Oregon. As we all know, housing has been very tight in the last few years and very short supply. And so we want to make sure that our landlords are not feeling the brunt of what is now, I think, a pretty deep recession based on the amount of unemployment. I believe we're up 485% on people filing for unemployment in a single week.
Wow. Thank you for your question. Next, we're going to have a question from Candace. Candace, are you there?
Thank you, Senator. My question is this. It's very disturbing that we hear that we have 18 people, then we have 20 people, and then we have 23 people in Deschutes County. But we really don't know what region they're in. We don't know if they're in north, south, east, or west, if they're related, if they're random people, and it's scary not getting the information that we know where these people are coming from or how they're related. Is there a way that the Deschutes County Health Department can give us a little bit of that information?
Thank you, Candace. It's a great question, and it's actually information I think that all of us would like to have. And here's for instance, Lynn County is not one of the most populated counties in Oregon. It maybe makes the top 10, but they have more cases than Deschutes County has. But their cases are at the Veterans Home. A good portion of their cases are at the Veterans Home in, I think it's Lebanon. And so that would be great information to realize and to know. And, likewise, I think a lot of people would like to know, was there an outbreak at one of our facilities here in Bend? Or is there an outbreak in a certain population? And we do know some things, that there are cases that have come into the public eye where we know that people are related. Lots of times husband and wife, or an adult and a child, but that child might be in their teens or 20s. But I think the majority of people have been over the age of 50 that have the virus here in Deschutes County, and it is some of them are community spread. We know that some of them came in from travel, but we do know that some of them had no contact with travel, and so we do know that the virus is in the community. And so if you fall into one of the risk categories, so if you're over 60, if you have had high blood pressure, if you have diabetes like I do, or if you have asthma like I do, or if you have heart issues, those all put you in high risk category. And so you need to do what you can to protect yourself. And every interaction you have with somebody else or out in the community is a potential risk to you. And so while, we don't want you to be fearful, at the same time, we do want you to be careful. And we want you to make sure that you're taking care of your health, that you're eating properly, that you're getting some exercise. Walking really is the best exercise. They don't want us participating in high-risk activities like rock climbing or backcountry skiing or things like that, because search and rescue here in Deschutes County is mostly volunteer, and those volunteers are going to have a hard time getting and finding people. And so they're asking us to, when we exercise, to be smart and to be healthy when we're doing it, and not take great risks, because it also puts, people getting injured, puts risk on the healthcare system as well. And you only want to be at the hospital these days if you really, really have to be. So that was a great question. And we are asking for more information. I can tell you one of the reasons they don't want to give information, and they didn't want to give information in detail initially, is they wanted to protect people's privacy, which we all understand, but they also wanted to make sure people knew that they could come forward and that they wouldn't be, sort of outed in the community as a coronavirus person. And so I know that's one of the concerns that they had initially. I think now that we're in a community spread situation, though, I think it is important that people have a little more information about, where the virus might be. But I think we have to assume that it could be anywhere in the community, and so we need to be careful. Obviously, continue to do what we can, washing our hands. Don't touch your face. Those things are really a must. And some people are wearing masks. I haven't been wearing a mask, but some people are wearing masks when they're going out in public. And so the main thing is do what's comfortable to you, and will keep you in the best health.
Great. Some really good questions tonight. Remember, if you have a question, just press 0, and you will go to one of our staff members who will put you in the queue. Be patient. We've still got a few on the line here, so it may take a second, but we'll be getting to you next. Up next, we have a question from Daniel. Daniel, are you there?
Yeah, my question is that the economy is going to be definitely taking a hit, and the state's not going to be getting as much money as expected. I was wondering if there's any chance that the legislature might consider reducing the state school fund, because we're into a budgeting process with schools right now, setting next year's budget, and don't want to set a budget and then we're way off because something changes for the amount of money schools will be getting.
Thank you, Daniel. That's a great question. So we got good news and we got bad news. So the good news is that we budget on a 2-year cycle. So this cycle's budget started in July 1st of 2019, and will go to June 30th of 2021. So this coming school year has already been budgeted. And the even better news is that we have about $2.6 billion built up in reserves. So some of that came from funds that were used to be the corporate kicker and get directed into an education stability fund, but just through saving funds over the last few years, really since the last recession, the state has accumulated about $2.6 billion. So the bad news is that you're right. The economy is taking a hit right now. There's going to be less revenue coming into the state. One of the things I fought for was a delay in your need to file your taxes on April 15th, because the federal government had already said you don't have to file and pay until July 15th. Well, you have to fill out your federal return in order to calculate really what your state return and taxes are going to be. So it didn't make any sense. Plus, we're only, obviously about 15 days away from what is normally tax day. And so after advocating for a delay, the governor was willing to do that and match what the federal government had done. And so you don't have to file until July 15th. Now, if you are a quarterly filer, so this is usually self-employed people and businesses, their quarterlies are still going to be due April 15th. And so make sure you're aware of that. But if we take a bigger hit than we have reserves to cover, then there are going to be reductions in the amount of, not the school fund necessarily, but there's going to be budget reductions budget-wide. And so we're going to have to look at that. When I was back in the House in 2002, after 9/11, the economy dropped pretty quickly, very rapidly, and we had a massive budget hole, and we had 5 special sessions that year. So I'm hoping we don't have that many, but if we do or more, we're obviously prepared to go in and do the best we can to take care of Oregon's most vulnerable citizens. But we want to make sure our kids are getting a good education, and that our teachers and workers are getting paid. And they do a very very tough job, and I think we're all finding out how tough a job they've had. So everybody has become a kind of a quasi-educator, right? Taking care of this very unprecedented time and educating our own kids. And so we're going to do the best we can with the money that we have available. and the taxpayer dollars. And I know that the school fund is one of the most important things to a lot of people. Normally when we, in a normal year, when you talk to people, education and funding and choices in education are always one of the top issues that people have. And so we're going to make sure that we're paying attention to that, and appreciate that question.
Yeah, another great question. Reminder that if you guys have a question for the senator, just press 0 and we will get you in line. Our next question comes from Drew in Tumalo. Drew, do we have you there?
Yeah, I'm here. Can you hear me?
Yeah, we can hear you. You are live with the senator.
Yeah, awesome. So I've had a few of my friends get laid off of work, and I know Congress federally just passed a big bill that does some things for unemployed workers. Do you know much about that? And then also, what is the state doing in that regard to help people who are getting laid off from this?
Well, thank you, Drew. Great question. One of the most important things is trying to keep money in the hands of workers who have lost their jobs, and maybe those jobs come back. I think most of them will. I don't know that all of them will. So no doubt new industries will ultimately get created, but it's really important that we get money into the hands of workers. Obviously, tomorrow we start a new month, and typically people's rents and sometimes car payments and things like that become due, and so we're trying to make sure that we're keeping money in the hands of those who have been unemployed. And so what I encourage anyone to do who has lost their job, and that includes the self-employed, you really need to go online to the unemployment department here in Oregon and file for unemployment online, and let them make the determination of what you're going to get and what you're eligible for. Because in previous recessions, there are some people who would normally qualify, or maybe they'd used up some of their weeks. So there's additional weeks. I think there's an additional 13 to 16 weeks of additional unemployment, and the federal government is basically doing a weekly increase from the federal government. There's state unemployment, and I think the max on that is around $540 a week, and it obviously depends on what you made as to how much you'll get a week. But then the federal government is adding up to another $600 a week to people's pay. So maybe in some cases getting close to doubling that. And so you'll definitely want to make sure that you have filed for unemployment. That's what it's there for. It's a very healthy fund right now. It's really important. We've tried to eliminate the barriers. Normally you have to wait a week, trying to eliminate that barrier. And so the important thing is that you file as soon as you possibly can and get your application in there so the money starts to flow as soon as it possibly can. So you don't miss too many bills, or you get money in your hand to be able to pay for the things that you need.
Another great, thank you. Next, we're going to take it to Sandra. Sandra, do we have you there?
Yes.
Go ahead.
Hi.
You are live with the senator. Hi.
I called in about getting help with food delivered for seniors. Is there a number in Deschutes County? And they were looking that up, and they put me on hold on that. But I have another question. When we start getting our bills from our different things, like for our TV and stuff, and we have preferred channels, can we call them because we're not getting those channels anymore? Can we do something about that in our next payment?
Well, Sandra, that's a great question. So as it relates to food delivery, definitely make sure that we have your email and that we can connect you up, because I know there are lots of community-minded people who have been shopping for people who need to have somebody deliver food. And so whether those are hot meals or whether those are meals that you can prepare yourself, I know that there are people in this community that would love to do that. And so make sure that we have your email. So my email was given out earlier, and it is Senator Tim Knopp, last name is spelled Knopp, and it's at gmail.com. And so we're using the Gmail address tonight to make sure that that gets to us as quickly as possible and that we can help you out. So that's Senator Tim Knopp at gmail.com. And if you need to call in for some reason and we lose you, you can call my home number, which is 541-389-7008. I've had the same phone number for about 35 years, so it's always been in the phone book, so I assume everybody's already got it. So now y'all have it, and I hope you'll only use it when you need to have it, and you'll have it in an emergency. So we want to make sure that everybody gets taken care of and all the needs are getting taken care of. And like I said, there's so many partners out there in the community right now who are willing and ready to help. And another place that you can go for help is also, it's called myoregon.gov. And so myoregon.gov has a lot of good resources on that page, and you can take a look at that. And there's also a number that you can call that is specific to information, and it's 211. So it's an info number, so not an emergency number, but an info number, so 211. And you can ask them any question, and they will try to connect you to the right resource. And so that's a statewide number, and you can use that wherever you are in the state of Oregon.
Another great question. Your reminder here that if you have a question for the senator, just press 0 and we will get you in the queue. Next, we have a question from Sue. Sue, do we have you there?
Thank you, Senator Knopp, for taking my question and taking time to talk to your community this evening. My question is around testing. How many tests are now being run in the state of Oregon, and also specifically in Deschutes County?
So we don't get the county numbers very quickly, but what they're telling us is that they're doing about 1,500 tests a day now. And so it depends on what lab that the test goes to. So there are labs at some hospitals in Oregon that are doing the tests and determining whether or not somebody has the virus or not. And some of those are out of state. And, the unfortunate part is that we've heard that people have been waiting up to 2 to 3 weeks to find out if they even have the virus, and that's way too long. And so we have been ramping up testing, and it's continuing to, I think, get better and better. It's still not where it needs to be, but it is, I think, getting to a point where there are so many more people being tested than there were a week or two ago. And the good news in all of this is that even though more people are getting tested, the numbers of those who actually have the virus are not rising dramatically. We've had between 50 and 90 people a day for the last few days that have been reported as positive on a statewide basis. And the numbers haven't increased all that much for about a week. They've kind of been in that range, and so I think it is good news. I can tell you that there's been 247 negative tests in Deschutes County, and they're listing us as 24 positive tests, and So that's where we're at currently. Statewide, 13,136 people have been tested negative, and 690 have tested positive. But if the numbers don't rise too much, even though we've expanded the amount of people being tested, that will actually be good news in obviously a very difficult time that we're all going through. And we're in this together. It's really important, and testing is going to be critical, because as we move from the phase of the peak of this disease, we want to obviously get our economy restarted as soon as we possibly can, and we're going to need to have testing available to make sure that people that are going back to work and in our community have the opportunity to be tested and get their temperature taken. That's one of the things. If you've if you've gone anywhere near a hospital or certain places of employment, they are checking your temperature with I think it's kind of an infrared, I would call it, infrared kind of scanner, thermometer, and checking people's temperatures, because that's one of the key things. They're doing this at some airports as well, to check and see if your temperature is elevated, because that is one of the key signs is a temperature that spikes. And so our testing is getting better, and thank you for that question. It's actually a great question, but we're going to want to make sure that tests are available, and that it doesn't take you multiple days to find out if you have it, and that you could find out hopefully the same day whether you have the virus or not. And remember that 80% of people are going to have mild to moderate symptoms, and they probably won't need hospitalization. You may visit your doctor, you may even visit the emergency room, but you might not necessarily stay in the hospital. But for that 20% of people who this can affect in a pretty dramatic way, and who are immunocompromised or fit into one of those high-risk categories, the virus can do a lot of damage, and we also know that it is deadly. And so we want to make sure that resources are there for that 20% who are going to really feel the biggest health impact of this virus.
Another great question. I know testing is a main concern of the community. Next, we have a question from Carrie. Carrie, are you there?
Yes.
Go ahead.
Hi.
You are live with the senator.
Hello.
Hello.
I'm actually one of the 20%. I'm the one on the critical side because I have tumors and COPD and asthma, and I've actually been told to stay in. And so now everybody's staying out, so I'm trying to care for myself, which is hard for me. And so now the main caregiver is working at a gas station, and I was just told the other day that he is now told that other people can pump the gas. So now I'm in fear, because the first thing that goes on in my head is, now somebody's going to get sick and touch the pump, and you're going to touch the pump and get sick. So, the first thing that goes on in my head is like, why are they changing the rules when I know he's being clean, and he was told, that he has to be really sanitary and wear gloves and all this stuff, and now all of a sudden somebody can get out of a car and just touch the pump and pump gas themselves. So I don't know what's going on with that, but I am concerned now. So now I don't want my caregiver coming over. And so it is a concern, because the people that are in my percentage, the people that are able to care for them, still have to go out and do other jobs sometimes too. And how is that working with this new gas law that they put out there?
Yeah, thank you, Carrie. That's a great question, and we want you to make sure that you're well taken care of, and that you are able to get the kind of care that you need. I was not a fan of opening up self-serve gas at this time. That didn't make a lot of sense to me. The protocols are that there's supposed to be an attendant there, and between each person who touches the nozzle, they're supposed to be basically sanitizing that with the wipes that people are using. The ones I can think of right now are like Clorox or Lysol wipes or what have you. Something that will kill a virus, but still, even if the attendant is wearing gloves and is wiping things down, there's always the chance that someone will touch their face, because we all tend to do it not thinking, and so that's one of the things that isn't supposed to happen. So I do understand your concern, and I think it's really important that we make sure that you're getting the care that you need so you can recover. So let us know if there's anything we can do to help in that regard. The order was given by the governor to open it up for self-serve right now. I don't think this was a good time to do that, but
no, not at all.
that has already been done, and so we want to make sure that you have the care that you need. You shouldn't have to take care of yourself in this situation. So please let us know, and if there's anything we can do to try to help you out, we most certainly will do that.
There's always good resources. There's always good people out there too, but the whole point is that it opens up more chances of disease transporting.
It does. Anywhere somebody goes. I mean, that's what I was trying to get the point across. Any encounter that you have outside of your home, which that you can control, because you can control who comes into your home, right? So kind of the home is your castle type of thing, and you can control that. But once you get outside your home, any interaction that you have with anything or anyone puts you at a certain level of risk, some higher than others. But I mean, some places have asked people not to bring bags back into the store, because they don't know where the bags have been, and so you think about all those interactions we have and those things that we do on a daily basis, whether it's touching the car door, touching the doorknob at any office that we go into, and so there's lots of different things where we might put our hand on it, and so we know the virus can live hours or days on surfaces, and so any of those interactions that we have do put us at risk, and that's why for a period of weeks the governor is asking people to have as little contact with each other as possible, which is very hard because we live in a community where people want to get out and
exactly
interact and recreate, and spring is coming. It's despite what the day we have today.
And I'm looking forward to it. I do want to take my dog out there and walk with my dog. I know I can do that, and I know I can do some things, but I also want to keep the elderly safe too, and do all that any way I can help as well. But I don't want to make other people sick if somebody else is getting sick as well. So I got to be careful.
Yeah, absolutely.
Because I know he just got, gas stations pretty hazardous right now with that new law coming out. I think I'm sure they'll be safe. Thank you.
Yep,
thank you, Kathy. We have time for a couple more questions tonight. Next, we're going to go to Bethany. Bethany, can you hear us?
I can. Can you hear me?
Yep, you are live with the Senator.
Great. Thank you. Thank you, Senator. I'm curious if you can share what resources are being allocated to our community from the state and the federal government.
Oh, thank you, Bethany. That's a great question. So we're still trying to calculate the federal law, which was passed last Friday and signed into law. But what we do know is it looks like about $1.6 billion is coming into the state for various programs. There's several $100 million that is going to unemployment insurance and unemployed people's paychecks, and then there's money that's coming in for hospitals, and there's money that's coming in for various other things. And then there's the money that I don't think we've really talked about it, but if you filed a tax return and you're under 75,000 as a single or under 150 as a couple, you're going to get $1,200 per person. So it's 2 adults. So if you're married, $2,400, and then $500 per child that's under the age 17 or under, I believe. And so that will come to you. If you do not have if you did not file a tax return, it's really important that you file the short form. So if you're a senior who didn't file a tax return, or if you were below the amount of taxes that you needed to file a return, you're going to want to file the short form return, and a tax preparer can help you with that, and you'll want to do that as soon as possible so that you'll be in the system. So even though you didn't owe any taxes, you'll want to file to make sure that they have your name and address so they can be part of sending you that check if you're wanting to participate in that particular part of the federal bill that passed. And so there will be substantial resources coming into the state. And I did hear that they were talking today about an additional stimulus package that had to do with transportation infrastructure. So around the country, our infrastructure is aging, our roads, our bridges, federal roads and bridges. And so there may be some transit in there as well. I have no doubt that there will be, but there's another stimulus package that they're working on to help create jobs and get infrastructure built that's going to be needed to move our economy in a positive direction as we're coming out of what I think is the coronavirus recession that's been brought on, as we had some of the lowest unemployment in the history of our country, and stock market was at a very, I guess, pretty much all-time high just a couple weeks ago. And so the virus obviously has had a big impact on it. But lots of resources coming to the state of Oregon. The state hasn't decided how much it's going to invest yet, and part of it is the governor would need to call that special session, or the legislature would need about 3 weeks to call ourselves in. It's a little bit more complicated process to do that, and there hasn't been a decision yet on how much money the state will invest for small business owners and those who are unemployed and landlords and those things to make sure that we keep money in people's hands and keep cash flow so people can continue to operate. But thank you for that question.
Yeah, great question, Bethany. We have about 5 minutes remaining tonight, so we are going to go to the next question, and hopefully we can get to another after that. We have Jessica from Tumalo. Jessica, do we have you there?
Yeah, hi. I work in education, and I have a couple of questions about finishing out the school year for students. One of those questions being, what about graduating seniors? Are they going to be able to graduate? Are there going to be, I know with students not going to school and doing distance learning, it might be a bit difficult for students to finish up any graduation requirements that they have to meet before the summertime so that they can be considered graduated on time. And then also, I was wondering about part of the recent orders about halting enrollment in virtual schools and how those types of schools are posed pretty well to help students in these types of situations. And it just confuses me as to why we would halt enrollment in schools that could be beneficial to students at this time.
Jessica, great question. So as it relates to seniors who are graduating this year, the goal is to make sure that they go to distance learning and they are working on the credit classes that they need in order to graduate. And so the goal is to make sure that seniors graduate on time. Obviously, they've been thrown a real curve, and it's going to be pretty difficult, more difficult than it otherwise would have been for them to get those credits. But the goal is to make sure that as many people as possible get the credits and graduate, and do that through distance learning. And there is no good reason why virtual schools will not be able to enroll more students, because they already have the curriculum and the ability to take on students who need actually some of those credit classes. And I know not all districts were ready for something like this to happen. Some districts had a lot more online learning and distance learning available than others. And so I do think that is the wrong direction to go to stop people from enrolling in virtual schools, because if there was ever a time that they were needed and were basically, this is the time that they were made for, this would be it. And so we want to make sure that students have access to all the resources that are available to them in this unprecedented time. So thank you for that question.
Yeah, another great question. We've got time for one last question. We have Dan. Dan, do we have you there? Dan, can you hear us? Okay, it looks like we may have lost Dan, so we will go to another question. How about, sorry, one second. Lizzie, Lizzie, do we have you there?
Hi, thank you so much for taking my question tonight.
Of course, you are live with the Senator. Go ahead.
Awesome, hello. So I'm a community member here in Bend, and I have quite a few friends who are business owners. And while this is a scary time for everybody, I think it's especially scary for those whose entire family livelihood are dependent on their small business, which a lot of them have been closed. So when do you think that those will be open again so we can start supporting a lot of our local families?
Well, that is a great question. I don't know the answer to that. If you are going to make me guess or bet, I would say probably mid-May, but don't hold me to that. I would like them to be open as soon as possible. The goal is to get past the peak of the infection and not to restart the infection rate and get that infection rate beyond the ability of our healthcare system to cope with it. And right now, our medical providers, our nurses and doctors, working long hours in difficult circumstances, and some healthcare workers, I don't know that there's been any locally, but I've seen media reports where at Providence, Legacy, and OHSU that medical providers, nurses and doctors, and others that are dealing with patients have been infected with the coronavirus. And so we need to get beyond that peak and get on the kind of the downward curve of the virus and the infections. And so my goal is to get our businesses opened up and going as soon as is practicable after that happens. And the governor will make that call, and I'm hoping that it isn't any longer than that. And so I would say we're about a third of the way through probably where we're going to need to be roughly in order for life to get back to a little bit more of a normal than we currently are. So thanks for that question.
Well, with that, we have reached our 1 hour time limit. Thank you, everyone, for joining tonight, for the excellent questions. It was a great discussion and a good update for our community on what is going on in the world today. Thank you, Senator, for having us. And remember that if you didn't get your question in, you can reach him at Senator Tim Knopp at gmail.com, and we will be able to get back to your question there. Thanks again for joining us, and have a great night.